Hi, and thanks for tuning in today for the COVID-19 vaccine update. I'm Lisa Almaguer, and today is Thursday, February 18th. Today we'll talk about new vaccine information released by the state for local health departments to follow, an update on our vaccination numbers, more information about second dose clinics, and finally I'll answer some popular questions that we've been receiving. So first, I'll start with our current vaccine numbers for Butte County. These numbers are only representing allocations received by Butte County Public Health. They do not include vaccinations or doses received by residents through other programs such as the Federal Pharmacy Program, CVS, or Tribal Health. So the total vaccines allocated to Butte County from the state, which as a reminder, I refer to the California Department of Public Health as the state. So that total number of vaccines allocated is 70,015. First doses ordered is 36,275. Second doses ordered is 28,800. And doses received is 54,625. Administered doses, also known as shots in arms, is 41,018. And people who have completed their full course, or we call fully vaccinated, so the first and the second dose, is 10,792. So that's the vaccine data for this week. Now I am going to share my screen with you and visit the Butte County Public Health vaccination page. Okay. And here we are. So here is the Butte County COVID-19 vaccine page, and I'm going to scroll down. As a reminder, as first and second dose clinics, COVID community vaccination clinics are scheduled, they will be posted here on this page. For residents who received their first dose, I'm just going to scroll down. We do have information about the CVS Pharmacy in Gridley. And then here we have second dose community vaccination clinics. And I'm going to scroll down. You'll see these three sections, and this is based on when you received your first dose. So today we've just opened up, if you received your first dose on February 1st through the 4th from the Enloe Clinic at Miriam Park, you can now schedule your second dose by clicking here, schedule online, or calling 552-3020, which is the vaccine scheduling hotline. It's important to note that this hotline really should be reserved for individuals who do not have access to the internet. Calling this line will not book your appointment quicker. It actually will be much quicker to click on this link and do a self-schedule. So these second doses will be administered on March 1st through the 4th. So I'll click on this schedule so you can see what it looks like. So here is what's called Sign Up Genius, and there's some important information to read. And then you'll scroll down. Here are appointments for the first. Looks like some of these are filling up, but lots still available. Keep going. Appointments for March 2nd. Keeps going. Appointments for March 3rd, and so on. Appointments for March 4th. So you can go ahead and click on those yellow sign up buttons to schedule your appointment. You do need to bring your CDC COVID vaccination card to your second dose appointment. This shows that you've received your first dose. If you don't have your card, you may be asked to return home to collect it. If you've misplaced your card, we believe staff will be on site with computer access to verify your first dose. Let's see. So lastly, lots of questions about first dose clinics, and we still don't anticipate another first dose community vaccination clinic until March. And as soon as we have those, we will post those on the Butte County vaccination page. So now I'll move on to new vaccination information released by the state. The state released quarantine guidance for people who are fully vaccinated, meaning they've had their first and their second dose of the vaccine. You might ask, why do I need to quarantine if I've been fully vaccinated? And the vaccine protects people from illness, so from actually feeling and getting sick, but it's still unknown if you can be infected without symptoms and then pass the virus on to others. So if you're exposed, potentially you could not be sick, but you could be asymptomatic and pass that on to others. So the guidance states that fully vaccinated persons who are exposed to someone with suspect or confirmed COVID-19 are not required to quarantine if the following are met. If it has been 2 weeks or longer since the second dose, if they are within 3 months of being fully vaccinated, and if they have remained asymptomatic since the current COVID exposure. People who do not meet the above criteria should continue to follow the current state quarantine guidance after exposure to a suspect or confirmed COVID. Fully vaccinated people should still watch for symptoms for 14 days following exposure. If they become symptomatic, they should be evaluated and also get tested for COVID. As a reminder, the OptumServe, the state's COVID-19 testing location called OptumServe in Chico, 900 Mangrove Avenue, has plenty of availability, and testing is still very important. So I will move, and I'm going to share my screen again to just a few of the popular questions that we have been receiving. Okay, so again, these are, it's got the wrong date on there, but it is Thursday, February 18th. And our first question is, when will you start vaccinating people who work in agriculture, food, and childcare? We are getting this question a lot. Unfortunately, we don't have a timeline for moving into additional priority sectors within the phase 1B tier 1, and this is for several reasons. We don't know how long it will take to finish vaccinating the priority population of 65 and older. We have not been allocated vaccines for additional sectors yet. And the state has announced vaccine priority for persons at high risk for COVID complications. And these are people with underlying health conditions between the ages of 16 and 64. And this priority is set to start on March 15th, I believe. We'll get to another slide. Does the agriculture and food group include grocery store and restaurant employees? Yes, it does, 100%. Come March 15th, will anyone with an underlying health condition get vaccinated? So no, March 15th is the date the state has announced for the beginning of the prioritization for this group. The state guidance indicates that healthcare providers will determine individual eligibility. At this time, we have more questions than answers about how this is going to work, and we will keep you posted as we learn more. Lastly, vaccination is based on allocated supply. So we wouldn't be able to open up on March 15th and offer a vaccine to everybody who qualifies based on an underlying health condition, because we likely will not have a vaccine dose for all of those people at one time. So vaccination is always based on the current supply. So that, I believe, is the final bit of information that I had to share with you today. Just some closing reminders that the vaccine is still highly prioritized for people in the 65 and older group. And as we have more first and second dose community vaccination clinics, we will always post those on the Butte County COVID vaccine website. We'll make announcements on our social media and definitely through all of the local media channels. So thanks for sticking with me today. And until next time, stay healthy. Thank you.